Let's discuss the divergent channel on the bladder channel. Pathway, the bladder divergent channel separates from the bladder primary channel in the popliteal fossa at bladder 40. It ascends to the center of the gluteal crease at bladder 36, ascends farther and penetrates the anus, continues to the bladder, its pertaining to organ, and the kidney, its paired sung organ, rises along the spine and spreads in the heart. From here, it ascends to the occiput, where it unites at bladder 10 with the kidney divergent channel and the bladder primary channel to form one of the 6 confluences. Here, kidney bladder as first confluence. Clinical importance, it strengthens the relationship between the bladder and the kidney. Points on the bladder primary channel can therefore be used for disorders of the kidney and vice versa. Points on the kidney primary channel can treat disorders of the bladder. Supports the connection between the bladder primary channel and the heart. Supports the connection between the bladder primary channel and the anus. Creates a connection between the popliteal region, bladder 40, and sacral region, bladder 32, bladder 31, as well as with the occipital region, bladder 10. The bladder divergent channel diverges from the primary channel in the popliteal fossa and ascends to a 0.5 June inferior to the sacrum, then winds around the anus, connecting with the bladder and dispersing in the kidneys. It ascends alongside the spine and disperses in the cardiac region, then emerges at the neck to rejoin the bladder primary channel. The bladder channel or foot-tying channel is exteriorly coupled with the kidney channel and paired with the small intestine channel of Han-Taiyang according to 6-channel theory. The bladder-kidney relationship is further strengthened by the fact that the bladder primary channel enters the kidney sound. The bladder primary channel meets the kidney channel at bladder 67. The bladder divergent channel disperses in the kidneys. The bladder loop connecting channel connects with the kidney channel. It is also important to note that the bladder primary channel begins at the inner canthus of the eye. The bladder primary channel intersects with the governing vessel at points do13, do14, do17, do20, where it enters the brain. The bladder primary channel descends paravertebrally in 2 lines, one at 1.5 June lateral to the midline, the other at 3 June lateral to the midline. The inner line includes the back shoe points of the 12 sanghu, as well as the vein meeting points for blood and bones. The bladder divergent channel winds around the anus. The bladder divergent channel enters the heart. The bladder sinuous channel passes through the axilla. The function of the bladder is to store fluid and via its G transformation action to convert the waste into urine for excretion. Like the small and large intestine and Sanjiao channel, however, there is little direct clinical relationship between the bladder channel and the function of the bladder fluid. It is true that several points of the bladder channel are important in the treatment of urinary diseases, but this is primarily due to the fact that they are the back shoe points of the Sanjiao, kidneys, or bladder, the bladder 22, bladder 23, bladder 28, respectively. Local points lying over the region of the bladder, for example, bladder 32, or distal points with a special relationship to fluid transformation, for example, bladder 39, the lower Hesi point of the Sanjiao. Thank you for your attention.
Now let's discuss Yuyao, point of the eye system. Yuyao, or XHN4, is located in the center of the eyebrow, with the eyes looking straight ahead directly above the pupil. How to find? With the patient looking straight ahead, palpate the eyebrow directly above the pupil, superior to the supraorbital ridge. There, locate Yuyao in a small depression on the superciliary arch. Needling 0.3 to 0.5 soon vertically or obliquely towards the eye. Actions, indications, benefits the eyes, dispels pain. Yuyao subdues liver yang. So this is good for headache behind the eyes, dizziness, blurred vision. Brightens the eyes for redness, swelling, and pain of the eyes, blurred vision, twitching of eyelids, drooping of eyelid. Yuyao is used for eye disorders such as blurred vision or floaters, particularly deriving from liver blood deficiency. It is also a useful local point for headaches from liver yang rising when they occur behind one eye. It also treats dull headaches from liver blood deficiency occurring behind both eyes. Yuyao is traditionally located lateral to the supraorbital notch from which the supraorbital nerve emerges. Indicated for redness, swelling, and pain of the eyes, superficial visual obstruction, twitching of the eyelids, drooping of the eyelid, and frontal headache. This point first appeared in the Classic of the Jade Dragon. In clinical practice, it is mostly selected in the treatment of supraorbital pain and diseases of the eyes and eyelids, and is stimulated by through needling from either GB14 or Bladder 2. Thank you for your attention.
Continue our discussion on channel. Let's now talk about the kidney divergent channel. Let us first trace its pathway. The kidney divergent channel separates from the kidney primary channel in the popliteal fossa at kidney 10. It meets bladder 40 in the popliteal fossa, ascends to bladder 36 in the center of the gluteal crease, penetrates the anus and reaches the kidney and the bladder. It then ascends to bladder 23 at the level of the lower border of the spinous process of lumbar 2, where it also meets the dimi, following it round the waist to the abdomen. It then ascends lateral to the midline of the infraclavicular fossa, reaches the neck at REN 23, and emerges at the nape of the neck at bladder 10, and converges with the bladder primary channel and the bladder divergent channel to form one of the 6 full confluences. Here, the bladder kidney as the first confluence. Clinical importance. First, it strengthens the relationship between the kidneys and the bladder of the Zhangfu organ systems. Points on the kidney primary channel can therefore be used for disorders of the bladder, and vice versa, points on the bladder primary channel can treat disorders of the kidneys. Through the connection with the dimi, kidney points can be used for disorders of the dimi. Kidney chi and essence are sent to the brain through the kidney divergent channel by the spinal canal, thus strengthening the connection between the kidneys, the marrow, and the brain. It also supports the connection to the tongue. To recap, the kidney divergent channel separates from the kidney primary channel and the popliteal fossa, intersects the bladder divergent channel on the thigh, ascends to connect with the kidneys, crosses the girdling vessel in the region of the second lumbar vertebra, ascends to the root of the tongue, and continues upwards to emerge at the nape of the neck and converge with the bladder primary channel. The kidney channel of Fu Shaoyin is interiorly-exteriorly coupled with the bladder channel and paired with the channel of the Han Shaoyin according to the 6-channel theory. The kidney-bladder relationship is further strengthened by the fact that, first, the interior pathway of the kidney primary channel connects with the bladder Fu. Second, the kidney Lu connecting channel connects with the bladder channel. And third, the kidney divergent channel intersects the bladder channel on the thigh. In addition, it is important to note that the kidney primary channel intersects the conception vessel at REN3 and REN4. The kidney primary channel ascends through the liver, diaphragm, lung, and heart. The kidney primary channel ascends through the throat. The kidney primary and divergent channels ascends to the root of the tongue. The kidney primary, lumen connecting, and sinus channels spreads into the spine. The kidney sinus channel, but that the kidney primary channel ascends to the genitals. The kidneys have 5 principal functions. First, storing essence and dominating reproduction, growth, and development. Second, producing marrow, filling up the brain, dominating bones, and assisting in the production of blood. Third, dominating water. Fourth, controlling the reception of qi. And fifth, opening into the ears and dominating the 2 lower yin, the anus and urethra. In addition, the kidneys are the lowest zang, are the root of the original yin and yang of the body, conserve and control the Mingman fire, house the will, and the foundation of the conception and penetrating vessels, which originates in the uterus, which according to the essential questions, the vessels of the uterus connect with the kidneys. Thank you for your attention.
Let's discuss the divergent channel, pericardium channel. Pathway. The pericardium divergent channel separates from the pericardium primary channel near P1. 1 tune lateral to the nipple on the level of the fourth intercostal space. It runs in the lateral direction to GB22, penetrates the thorax, continues to the heart, and divides into 2 branches. One branch connects with the upper, middle, and lower burner. The other branch ascends to the neck to REN23 and continues to the lateral aspect of the neck. Emerges at the TV16 on the posterior border of the sternocleidomastoid muscle on the level of the mandibular angle, connecting with the triple burner primary channel and the triple burner divergent channel to form one of the 6 confluences. Here, the pericardium and triple burner as 5th confluence. Clinical importance strengthens the relationship between the pericardium and the triple burner, the Sangpo organ system. Points on the pericardium primary channel can therefore be used for disorders of the triple burner. Vice versa, points on the triple burner primary channel can be disorders of the pericardium. In contrast to the pericardium primary channel, the pericardium divergent channel reaches the occiput and the neck. This explains why several points on the pericardium channel can be used for disorders of the neck and ears, chronic throat pain, etc. By reaching the thorax, breast, and hypochondrium, the pericardium divergent channel supports the relationship between the pericardium primary channel and these regions. The pericardium divergent channel separates from the primary channel on the arm at the level of a point below the axilla and 3 tune inferior to GB22, enters the chest and communicates with the 3 jiao. A branch ascends across the throat and emerges behind the ear to converge with sound jiao channel. The pericardium channel of the Han Jiao originates in the chest and descends through the diaphragm to the middle and lower jiao. It is exteriorly coupled with the San Jiao channel and with the liver channel to foot Jiao according to 6-channel theory. The pericardium San Jiao relationship is strengthened by the fact that a branch of the pericardium channel separates from P8 in the palm of the hand and connects with Sanjiao 1 on the ring finger. The pericardium divergent channel connects with Sanjiao channel behind the ear. As far as the pericardium luo connecting channel is concerned, in the spiritual pivot, At least there is no reference to it connecting the Sanjiao channel. In addition, it is important to note that from P6, the Lu connecting channel travels to the heart, strengthening the pericardium-heart relationship. The pericardium primary channel originates in the chest. Its divergent channel enters the chest, and its sinuous channel disperses in the chest. The primary channel descends through the diaphragm, and the sinuous channel binds at the diaphragm. Both the primary and divergent channel connects with the upper, middle, and lower jaw. The primary channel arcs over the axilla, and sinuous channel travels in here to the axilla. The sinuous channel disperses over the anterior and posterior ribs. Thank you for your attention.
Now let's have an overview of the points of the small intestine channel. Tonification point is SI3, sedation point SI8, horary point SI5. SI1 is frequently used for breast, headaches, eyes, and mucous membranes. SI3 relaxes muscles, neck and back pain, arthritis in joints, headache, spirit point. SI6, similar to SI3 for neck and back pain, vision, and red eyes. SI7 for spirit, depression, anxiety. SI17, sore throat, tonsillitis. SI19, local point for the spirit and ear stuff. Specific points according to their function. Yuan source point is SI4. Luo connecting point is SI7. Shi cleft point SI6. Associated backshoe point, bladder 27. Associated front move point, Ren 4. The 5-shoe transporting point, Jingwell, metal point is SI1. Ying spring point, water point, SI2. Shoestring point, wood point, tonification point is SI3. Jing river point or fire point, pen point, SI5. Hussey point, earth point, tonification point, SI8. The Hui meeting point or the opening point of the Tumai, SI3. Lower Hussey points, the Jiao Hui meeting points with the bladder channel, the Yang Wei Mai, Yang Chao Mai, SI10. With the LI, TB, GB channels, SI12. With the TB channel, SI18. With the TB, GB, SI19. Of other channels with the SI channel, LI14, DO 14, bladder 41, bladder 11, stomach 12, REN 17, REN 13, REN 12, GB1, GB11, TB20, TB22, bladder 1. Kao Wu command point or the window of heaven point, SI16 and SI17. Points of the 4 Cs. Madanyang heavenly star point or the Sun Si Miao ghost point is the local. So now we go to the points according to region. Local points, face and cheek, SI18. For the jaw, SI19. Local point for the neck, SI17. For the ears, SI19. Shoulder, SI9. SI10, SI11, SI12, SI13, SI14. Local point for the elbow, SI8. For the hand, SI4, SI5. For the finger, numbness and pain, SI3. For the finger, stiffness, SI3, SI5. Adjacent points for the shoulder, SI9, SI15. For the finger, SI5. Distal points for the occiput, SI3. For the eyes, SI6. For the cervical and thoracic spine, SI3. For the thoracic spine, SI6. For the lumbar region, SI3, SI6. Specific points according to the channel pathway in numerical order. SI1, Jingwell point, metal point. SI2, Ying spring point, water point. SI3, shoestring point, wood point, tonification point, Opening point of the tumai, distal point for the occiput and the lumbar region. SI3 is also the local point for the fingers, distal point for the cervical and thoracic spine. SI4, Yuan source point, local point for the hand. SI5 is Jing River point or far point, pen point, 5 faces, local point for the hand and fingers for stiffness, regional point for the fingers. SI6, Shi cleft point, distal point for the eyes, the thoracic and lumbar spine. SI7, Luo connecting point. SI8, Husi point or earth point, sedation point, and the local point for the elbow. SI9, local point for the shoulder, often sensitive to pressure. SI9 to SI15, adjacent points for the shoulder, often sensitive to pressure. SI10, Chao Hui meeting point with the bladder channel, the Yang Wei Mai, Yang Chao Mai, local point for the shoulder, often sensitive to pressure. SI11, local point for the shoulder, often sensitive to pressure. SI12, Zhao Hui meeting point with the LI, TB, and GB channels, local point for the shoulder, often sensitive to pressure. SI13, local point for the shoulder, often sensitive to pressure. SI14, local point for the shoulder, often sensitive to pressure. SI16, window of heaven point. SI17, window of heaven point, local point for the neck. SI18, local point for the face and cheek, Zhao Hui meeting point with the TB channel. SI19 is Chao Hui meeting point with the TB-GB channels and a local point for disorders of the ear and jaw. Thank you everyone for your attention.
Let's continue with the gallbladder channel. Today we discuss the gallbladder divergent channel. First, we explore its pathway. The gallbladder divergent channel separates from the gallbladder primary channel near gallbladder 30. According to some authors, it separates on the thigh. The illustration on the right shows the variant where it separates. So from gallbladder 30, it traverses the hip region to the anterior aspect of the body, then reaches the inguinal region and crosses the liver divergent channel at REN 2. It then ascends to the abdomen to liver 13 below the free end of the 11th rib. It then continues internally along the thoracic wall and connects with the gallbladder and the liver and passes the heart, and then ascends to the neck and emerges on the lower jaw. It disperses on the face, connects with the gallbladder primary channel and the liver divergent channel to form one of the 6 who confluences. Here is the gallbladder in the liver as the second confluence. And finally, it continues to the eye system and ends in the brain. Clinical importance. It strengthens the relationship between the gallbladder and the liver in the Zhang Fu organ systems. Points on the gallbladder primary channel can therefore be used to treat disorders of the liver and vice versa. It also supports the relationship between the esophagus and the heart, and the liver bladder and the gallbladder divergent channel covers the area around the eyes, thus supporting the action of some gallbladder points for disorders of the eyes. To recap, the gallbladder divergent channel diverges from the primary channel on the thigh, enters the pubic hairline, which it converges with the divergent channel of the liver, enters the flank between the lower ribs, connects with the gallbladder and spreads upward through the liver, proceeds upward across the heart and esophagus, and emerges at the lower jaw, disperses in the face, connects with the eye, and rejoins the gallbladder primary channel at the outer canthus. The gallbladder channel of Fu Shaoyang is interiorly exteriorly coupled with the liver channel and paired with the Sanjiao channel of the Han Shaoyang according to the 6th channel theory. The gallbladder-liver relationship is further strengthened by the fact that, first, the gallbladder primary and divergent channels connect with the liver. Second, the gallbladder-loo connecting channels connects with the liver channel. And third, the gallbladder divergent channel connects with the liver divergent channel. In addition, it is important to note that the gallbladder primary channel begins at the outer canthus and travels to the infraorbital region, whilst the gallbladder divergent channel connects with the eye. The gallbladder primary channel crisscrosses the side of the head as well as meeting with points Sanjiao 22, Sanjiao 20, and stomach 8 in this region. The gallbladder primary channel both passes behind the ear and enters the ear. The gallbladder primary channel passes through the jaw and the throat region. The gallbladder primary channel descends through the chest and connects with the pericardium channel at pericardium 1. The gallbladder primary and divergent channels pass anterior to the axilla. The gallbladder senior channel links with the breasts. The gallbladder divergent channel connects with the heart. The gallbladder primary channel passes through the inguinal region and encircles the genitals. The gallbladder primary and divergent channels goes to the sacrum, and the primary channel connects with Do1. Thank you for your attention.
Let's discuss the Sun Si Miao ghost point. LI11, human, J1. Pull at the foot, Chi Chua, LI11. Location with the elbow flexed on the lateral end of the elbow crease in a depression between the end of the crease and the lateral epicondyle of the humerus. On the extensor carpi radialis longus muscle. How to find? First, with the elbow completely flexed, locate the lateral end of the elbow crease. Next, with the elbow flexed at approximately 90 degrees, palpate for a pressure-sensitive depression in this area on the extensor carpi radialis longus muscle. LI11 is located close to the border of the proximal aspect of the ulna. Also located at the level of the elbow crease are lung 5, P3, radial ulnar of the tendon of the biceps, and part 3 with the elbow completely flexed at the medial end of the cubital crease. Needling vertically 1 to 1.5 June. Actions indications: clears heat, expels wind. Clears yang min, fire. Pulls the blood, drains dampness, alleviates itching, opens the channel. Special features: Lucy point, earth point, tonification point, Sun Si Miao ghost point, Madan Yang heavenly star point. Important point for heart conditions and disorders of the upper extremity. Very important point for skin diseases both from blood heat and damp heat. Important point to clear heat in general. Frequently used for channel and joint problems of the arm in painful obstruction syndrome, V syndrome, sequelae of windstroke, and atrophy syndrome. Like LI5, it is able to clear yang min, fire, which transmits to the heart and spirit, and it's indicated for agitation and oppression of the chest, mania disorder, and tongue thrusting. For this reason, under its alternative name of ghost leg, LI11 was included by the Sun Si Miao among his 13 ghost points for the treatment of mania disorder and epilepsy. Earth point, tonification point, Lucy, antique autumn point, ghost point, Madan Yang, heavenly star point, metal precision point. This valuable tonification point can strongly invigorate the meridian. It can be considered for problems in the face, example, eye disorders, especially when accompanied by extreme redness and pain. earache, toothache, along with LI4 and LI7, bronchitis, and high fever. This point may be effective in cases of chronic constipation, excellent for bringing stability to the LI. It's the earth point. Consider this point before releasing the internal dragons if a degree of possession is suspected. It is a ghost point. For problems of the shoulder, upper arm, and forearm. Okay, 1, MHN 37 C spring. Location in the center of the frenulum of the tongue between the Jin Yin and Joy Yi. Location note, the tongue should be rolled back to locate and treat this point. If required, the practitioner should roll the tongue back using a gauze swab or wooden spatula. If the deeper needling method is used, the tongue then rests on the needle with mouth closed. Needling 0.1 to 1, 0.1 to 0.2 tune or prick to bleed. 1.5 tune directed towards do 15. Actions: clears heat and reduces swelling. Generates fluids, benefits the tongue. Indications: heaviness, swelling, and pain of the tongue. Lotus flower tongue in children, facial paralysis. Wasting and thirsting disorder, vomiting, abdominal pain, diarrhea, hiccup. This point, also known as ghost seal, was included by Sun Miao among his 13 ghost points for the treatment of mania disorder and epilepsy, although not commonly used in modern clinical practice due to its location. It is mainly indicated for acute or recalcitrant disorder of the tongue and for facial paralysis. The spiritual pivot warns against needling this point to excess, since it may lead to incessant bleeding and loss of voice. Thank you for your attention.
Now let's discuss the TCM etiology of cough. External pathogenic factors. External wind is the main cause of exterior coughs. Wind penetrates the skin and the defensive chi portion, which is controlled by the lungs. It therefore impairs the descending of lung chi and causes a cough. This is an exterior type of cough that, with proper treatment, disappears rather quickly without any consequences. Wind combines with other pathogenic factors, and the most likely to cause a cough are wind cold, wind heat, and wind dryness. Wind cold invades the skin and the defensive chi portion, impairing the descending of lung chi and thus causing a cough, usually with a white nasal discharge. Wind heat enters via the nose and mouth and affects the throat. It causes a cough by invading the lung channel in the throat and preventing the descending of lung chi. The cough caused by wind heat is of a drier type than that caused by wind cold. Wind dryness, rare in the British Isles but rather prevalent in the American Southwest, also invades the lung channel in the throat and causes a very dry and ticklish cough. Besides impairing the descending of lung chi, wind dryness also dries up the lungs fluids, and the resulting cough is more persistent than that caused by wind cold or wind heat. Emotional stress. Worry is a frequent emotional cause of cough. It affects the lungs directly, and it knots the chi, preventing the descending of lung chi. The resulting type of cough is dry and irritating. Sadness and grief deplete lung chi, and they may cause a deficiency type cough, as the deficient lung chi fails to descend. Prolonged anger, frustration, or resentment lead to stagnation of liver chi and, over a long period of time, to liver fire. This may invade the lungs and prevent the descending of lung chi, causing a cough. Excessive consumption of sweets, greasy foods, and dairy foods may lead to the formation of phlegm, which settles in the lungs and prevents lung chi from descending. This causes a cough with profuse expectoration. Excessive consumption of hot foods, alcohol, and fried greasy foods leads to the formation of heat and phlegm. Phlegm settles in the lungs and impairs the sending of lung qi, while heat dries up the lung fluids. Both these processes cause coughing. Excessive consumption of cold and raw foods, such as salads and fruit, impairs transformation of fluids and may lead to phlegm, which settles in the lungs. A chronic illness affecting the lungs weakens lung qi and or lung yin. The deficient lung qi fails to descend and causes a chronic cough of the empty type. Thank you very much for your attention.